Hello, my name is Dr. Scott Young with Hearing Solutions Centers, and today we're going to have Steve with us, Steve Crum, and we're talking a little bit about the home care program. Coming right up. Okay, so Steve, talk to me about your experience in the field of hearing.
Well, hearing is something that I've got a passion about because I feel like for people to be able to enjoy life, they need to be able to hear, they need to be able to understand the conversations in the world around them. So when I was looking for a vocation or a career to get into, I looked at several different things but landed in this area because I just felt like it was some way that I could be affecting people's lives,
Right.
and helping them to enjoy their quality of life better.
Okay.
The hearing healthcare program is something that has kind of evolved out of that. You and I have worked together for several years, and we started in an office.
Yeah.
But a part of that we found was people that would call up and say, hey, I just can't get into the office and need somebody to come out and see me. And it was kind of at first a experimental kind of a thing, not knowing what we were going to do. And we went out to somebody's home and through that over the
period, late 80s, early 90s.
A long time ago.
Yeah.
No, we're not that old, but
yeah.
Anyway, we started doing that, and we found out, well, these people, even if they're isolated, even if they're at home by themselves and don't get out of their homes that much, still need to be able to hear and understand. So when family comes over or when a doctor or a nurse comes out to the house to administer care to them or something, that they're able to keep up with the conversation, hear the instructions.
Right.
That those people give us.
Right.
So this home health care situation that we're doing now kind of was born out of that necessity that we saw for people.
And I think that's the key element I want to share more with you in that way is that, when Steve and I have worked together a couple times, and he kind of approached me a little bit because he's at another place and really wanted to do something different. I think what's cool about Steve is he really wants to be a bivocational pastor. He's doing some of that right now, but would like to kind of move into that next phase. And so bivocational means, he's going to be a pastor, but, and he already is, but, a little bit more into it in that way, but also doing hearing healthcare. And so, and when we talk about the home healthcare program, frankly, it's not an easy thing to do.
No.
It is. It can be chaotic. It can be, phones in the background. You've got to manage some of those things. People asking questions in the background, and then he's trying to test the hearing of the person in her comfy chair or whatever or maybe sometimes in bed.
Even happens.
And so the one thing that we really wanted to work together on is that first off, Steve knew this. Steve knew how that worked, how it handles, what kind of modifications that you have to make to the testing environment, because it's not perfectly ideal, but the reality is that person can't come to the office.
Right.
So talk a little bit about the patients that might be effective on the home care program.
Well, I'll see people who are, like you said, maybe bedfast. They just can't get out of bed. And so how do you put a set of headphones on somebody to test them in that situation? Or they may be on medication. How do you test them because of their different medications that they're on? They're inviting you into their home.
That's a big deal too.
It's like, hey, I'm their guest in their home, and I'm trying to bring them something that will improve their life in their environment.
Right.
Even though it's a difficult environment to test in, the nice thing about it is that you are actually testing them in the environment that they're going to be spending 90 to 95%, if not all of their time in. So you have those consistent background sounds that you might have to deal with.
Right.
You're testing them and the refrigerator comes on and it's excessively an old loud refrigerator. Well, this is something they're going to have to deal with their hearing aids, or it's this noise or that noise or traffic going by outside. Typically we do what's called a biological calibration on our equipment, to make sure that the testing is accurate. But then you're making fine-tuning adjustments just based on that person's home and their
Correct,
lifestyle.
but I think the one thing that we try to do is we do more isolation-based systems.
Right.
So we're using insert monitors. So
Right.
the insert kind of ones, we're going to much more isolate that patient so that she's not hearing the other outside noises as much. And that's, most people don't know how to do it.
Right.
And that takes some, again, all of it's an art form in some ways. I mean, this is, I promise you, you and I both have seen hearing aid dispensers and audiologists try to do the home call, and they've failed miserably.
Right.
Why do they fail miserably doing this?
Lack of experience probably is one of the biggest ones. You learn, even us, when we first started doing it, we
Yeah.
learned from the mistakes that we made.
Yeah.
We learned from trial and error, so to speak, as a part of it. I mean, clinically, you can do everything correctly in a home that you would do in an office in a situation, but because the environment is different, because the distractions are different, because everything else is different, you might have to stop right in the middle of a particular test,
Right.
as an example, just to wait for a few seconds for a noise to dissipate or for something to change or whatever. I've been in a testing situation where right in the middle of the test, the grandkids show up and they come bursting into the room and start, "Hey, Grandma, what's going on?"
Yeah,
Yep,
exactly.
sorry, And then you got to wait 15 minutes until the reunion is over with
Right.
before you continue with the testing process or something.
Right.
So it's just a unique environment, unique situation to take all of that into consideration.
And one of the things that we don't really want to do, and we're real careful about this, hey, listen, if you can get out to our office, that's the best way of handling
Right,
this circumstance, okay? And we have an office with the big sound booths and all the other stuff that we can get the very, very unique way. But we have this home call system. And by the way, all over every city, someone tries to do this. And, even in our city, we have people that are trying to do it. And again, like we're saying, that they fail miserably because they don't know how to do this. It is a very unique way of handling it. It takes effort and time and skill and ability with that too. It takes patience as well. But the key elements that we want to see are patients who are much more homebound. And that's we're really focusing this on the homebound people.
Right.
So what are people, I mean, can you give me examples of some of the types of people that might utilize this? So if you're sitting there on YouTube saying, would my mom qualify for this thing? What would you say about that?
The typical people we're going to see, I guess we could start a worst case scenario, would be someone who is bedfast.
Right.
Someone who just absolutely positively no way can leave their home. They've got nursing care coming in constantly to help take care of them. Those people obviously would qualify for the program. But then you have those who maybe they themselves don't have a vehicle, they don't have transportation, they don't have the ability to just go jump in the car and drive somewhere. And at the same time, maybe their children aren't able to bring them for whatever, they live out of state or they can't get off work or things like that, but they need our help to come see them.
Right. But again, it's made for a person who's in a quiet, very quiet,
Correct.
super quiet, lifestyle.
Well, and then that leads to the next thing too. As our company's name says, we are hearing solution centers. So we're trying to provide a solution for every situation,
Right.
but also with their hearing itself.
Right.
We want to fit them with the type of a hearing instrument that their unique situation
Correct.
recommends for them.
Right.
If they're not in a very noisy environment, not in a very noisy lifestyle, they spend all of their time at home, their needs are going to be totally different than someone that was working full time and in excessive noisy environment.
So therefore, someone, and this is one of the big reasons why most of these other places will fail at this, is that they're trying to force a person to get a higher technology than they could ever need.
Or that they need, yeah.
And I think that's one of the things that Steve and I have spent a lot of time talking this out to try to figure out how we wanted to be able to modify that for that patient that's in a home, or so you don't want to just think about someone who's necessarily in a nursing home, but what other types of living situations do you find,
Well, you would
that you
have
could do?
nursing homes. You would have private homes. People who are living still in their own home but have nursing care coming in to see them. You would have people who are living in retirement facilities that just don't have transportation. And a lot of those facilities will provide
Right.
transportation for the person, so
So they'll come to the
they can
office
still
with
come
that
to
too.
the
Right.
office. But even in those facilities, there are going to be some people who just
They
can't get
can't get
out,
out.
or
Right.
it's very difficult for them to get out. In order for them to get out, they have to call a lift chair, they have to call an ambulance service to
Right.
help provide to get
Right.
them there, where they can function within their own apartment. But outside of that environment, they are helpless, basically, or
Right.
are very
And
limited.
assistive living centers
Assisted
too.
living, uh, and just in general, I guess, is say, the general description would be those people who would just really be totally inconvenienced or have no possible way
Right.
of getting to our office on their own to get the help here. Those are the people that we're reaching out to try to help.
And I think that's the key I want you to think about when you're thinking about your mom or your dad, or you're watching this, and you have that physical infirmity that won't allow you to get out. That's really where you want to call us. And we're also talking to a lot of home health care
Right.
facilities. We have assistive living facilities. So if you're working in a assisted living facility, this is another benefit that we can actually accomplish for you with that too. So I think that's one of the things that we're
Right.
trying to really reach out for people so that they have that capability in there as well.
Well, and again, the bottom line is quality of life.
Right.
Overall, uh, how many people say, they live in that assisted living facility, but they're turning their television up so loud that it's interfering with the people in the
Yeah.
apartment next door, or the
Yeah.
people walking down the hallway. I go into those facilities, and the staff in those facilities say, "Oh, I know of somebody that you need to go see," because
Right.
they can tell
Right.
they're having to repeat themselves all the time to those people. And so even in a limited environment, your ability to hear and understand and your quality of life is very important.
Right.
Um, when those kids come over, how often do they come? And when they do, you want to be able to enjoy
Mhm.
the time that you have with them.
And
Uh,
that's, I remember a patient years and years ago that said to me, my mom has 6 months to live. And I got really hesitant at that moment. It was like, well, wait, do you really want to spend the money on hearing aids? No, we have stuff to say.
right.
Okay. And, they did it. And she actually lasted for 9 months. And he told me a little bit about the stories with that circumstance. But I think one of the cool things that we're trying to accomplish here, to make a difference. So if you're thinking like that assistive living center, if you're, a home healthcare, assistant, or you're, or, mom and dad, or you're thinking about them and having that circumstance, I think that's where the uniqueness that Steve is. And I always try to say this is, I hear this all the time. Places want to tell you about integrity.
Right.
And when integrity comes up as a word, Steve and I both, get into the definition of words, especially in the New Testament and the Old Testament, with that too. But one of our keys is that integrity can't be defined by the words that you say. Integrity is what you do.
Right.
It doesn't come any other way. And I challenge anyone to push me on that issue, because they're going to lose, because the integrity comes by what you do.
Exactly. Well, we're known by our actions.
Right.
You can talk a good game, but how do you play?
Right.
And we want. I, I want, you want, as a company representing not only hearing solution centers, but trying to represent, our Christian values and what we say and what we
Right.
do. We want to go into someone's home and them know that they can refer us to their next door neighbor
Right.
or to another family member. Uh, I don't know how many people over the years have said, "Oh, well, so and so told me that you're a person that I can trust,
Right.
or you're a person that I can believe in. That you're going to tell me the right thing to do." I've
And the
gone
proof's
in.
in the pudding.
I've gone into people's homes who have hearing aids that are maybe 3 years old, and someone has told them the only thing that they can do is to buy a new set of hearing
Hmm.
aids. And I checked the hearing aids, and the only problem with it was is that the person who they talked to was too lazy to clean their hearing aids properly. And once you clean the hearing aids up, they heard perfectly well with them and didn't need to spend money on a new set of
Correct.
hearing aids.
Correct.
But that's the kind of thing that we will do. We'll check their hearing aids to tell people you don't need a new set of hearing aids. You just need these adjusted, or you need the existing ones reprogrammed, or whatever we need to do. It's not always about just selling a new set of hearing aids. It's about doing the right thing in
Always
every
the right thing.
situation.
Right
Yeah.
thing. Yeah. And so, and you need to have that. If you're the assisted living center, you don't want to have a lot of complaints in that way. I mean, by the way, you get complaints. Everyone gets complaints of something's going wrong. Well, and that's a situation we need to fix it. Happy to fix it for you. And that's the kind of thing. One of the things that Steve and I have really kind of worked on is that the home care program, it is $100 fee. For us to go out for
Right.
the initial visit, and do the do the whole consultation process.
Correct.
So it does compensate Steve to, be able to get out there, set up, do his thing, take care of your needs. So it is $100 fee, and that's the only thing that's required out of that. Other than that, whether hearing aids might be done or not done, whatever, it's still $100 fee.
Right.
The second thing is that you might have a person that, he might say, well, that 3-year-old set of hearing aids, right?
Right.
Went out for $100 fee, checked it all out, did the evaluation, matched up the prescriptions and said, you're okay. Well, then he might say, well, would you come out every 6 months?
Right.
And what would that kind of fee be at that point?
We charge $75 for that.
Yep.
That initial fee is $100, but anything beyond that, if we have to come back out, is a $75 charge.
Right.
Yeah.
So, and those are some of the things that we want to do. We always want to be upfront with you so that that thing out there with that. It's not, we don't want to have hidden fees. Both of us hate hidden fees. I mean,
Yeah.
can't stand it. So we want you to know directly up front. And most patients go, yeah, man, please, what do we need to do?
Well, the time involved, and in that initial consultation, we're going to visit with you about your lifestyle. We're going to visit with you about what you feel like you want to hear that you're not hearing. We're going to check your existing hearing aids, if you have existing hearing aids, to see what they're doing or what they're not doing. We're going to clean your hearing aids. We're going to, it's not just a 5-minute process. It's a time consuming process. I say time consuming. It's a necessary amount of time that it takes in order to
Right.
give a proper evaluation as to what a person needs, and then make a decision based on all the findings that we get from that initial consultation.
Right.
So, everything that we do is geared towards, again, that person and helping them and have the best quality hearing that they can have.
Right.
In the lifestyle and the situation that they're in at this point in their life.
Right. And that's the kind of thing that we want to do with that too. So if you're thinking, and my mom, my hearing care facility really could use that help, that's where we want to be able to, be that opportunity. Now on our website at heartulsa.com, you'll see the home care page that explains a lot of this kind of stuff.
Right.
Steve's phone number is
918-633-4308.
So 918-633-4308. And you can call us. It'll be in the descriptors in there with that too. But I think that will help you, be able to call. You can call us directly at the office, and we will refer you over to Steve. So we'll, get that set up in time frame with that too. And I think that's going to be really powerful for you when you're considering the services with that. So we just thank you for listening.
Yeah.
Leave comments down below. Subscribe to this. If you're really looking at that, you can give us a call. Thanks so much.
Thank you a lot.